Hello, everyone. So we're starting with hematological disorders, chapter 22, sorry, 23 of illustrated textbook of pediatrics. Features of hematological disorders in children, changes in the blood count during childhood mean that it is important to use age-adjusted normal ranges. Iron deficient anemia is common causes of hemolytic anemia, includes cell disease, thalassemia, G6PD deficiency, hereditary spherocytosis, the most common genetic causes of abnormal bleeding are hemophilia A and B and one disease. Petechial purpura may not be non-thrombocytopenic, hemoglobin purpura, sepsis trauma, or thrombocytopenia. Immune thrombocytopenia leukemia disseminated intravascular formation, TIC. Hemopoiesis is a process which maintains right from production of hemopoietic blood cells. The main site of hemopoiesis throughout personal life is the bone marrow. All hematopoietic cells are derived from hematopoietic stem cells, are crucial for normal blood production. Deficiency of these stem cells causes bone marrow fluid disorders, aplastic anemia, because stem cells are required for the one-way replacement of dialysis. Hematopoietic stem cells can also be used to treat many cells when the donors can be transplanted into the bone marrow for real stem cell transplantation. Hematological values of birth, features of birth, and organ concentration in both the beta and present normal heart for the gram compared to 250. To compensate for the low oxygen concentration in the fetus, the HB pause naturally over the first few weeks prior to reduce red cell production, reaching level of around 100 gram and 2 months. Age, normal hematological values of growth and age are shown. Preterm baby have a stable fall and HbA to remain from 65 to 90 or 4 weeks. To 8 weeks chronological age, this is mainly due to reduced blood cell production in lifespan. The main reason of labor at birth, 60% growth in term increase speech death, with no labor. Almost all the remaining labor at birth is HbA around the labor. Healthy babies HbA expression falls to around 1% at the age of 12 months. At the same time, essentially function rises. This group has a higher affinity for oxygen than this group. I don't remember, but it's because better able to hold on the oxygen and nitrogen when you have oxygen level. It is normal but volume and those days with gestation age. It is increased by pH sample of the better guard. And have a determined average by volume is 80 ml per kg, determined as average by volume is 100 ml per kg. Stores of iron, folic acid, hyperweight, and don't be decided with birth, when determined beds, stores of iron, folic acid, and lower and are depleted more quickly. Leading to deficiency of 15 to 4 months if the recommended daily intakes are not maintained by supplements. White blood cell count neonates and higher than the children, the 25, 6 counts in birth and then normal blood cells around 82 to 400. 9 per liter. This is something of a birth is constitution method more than 1 decade. It falls to low level at lowest level at 2 months age. These people just reduce approximately 1% remaining at 12 months, and these are the upper limit of normal, meaning lower limits of normal, and changes in the level concentration. Within first is gradually falls deeper to the lowest it is in 2 to 3 months, and then it is normalized. Lower limit of norms are also given, and then upper limits are also given in gram per lowest concentration. According to its lowest concentration, 2 months to 3 months 8. And then the hemoglobin factors, newborn is adult is 25, 70% people and 1%, adult is 97, 2% should be 1% falls because of the is more than 80. Which is in place in more than 80%. Recessive major does not happen if we and it's usually to a ratio of less increase. Sickle cell trait as usually to sickle cell trait. X is also sickle, it's also possible. And sickle cell disease, spiral, is not present. Other non-relevant types are present. And the most defines is below the normal range. Normally range within a certain year can be defined as no need, which is less than 140. 1 to 12 minutes of phase is less than 100, and 1 to 12 days of phase is less than 110. And no results from one or more of the following mechanism reduce as let's say production either due to let's say hyperplasia or qualitatively normal erythropoiesis and efficiency most common cause of anemia, increased red cell production analysis. Blood loss will be uncommon cause in children. There may be a combination of these three mechanisms anemia prematurity. Using this approach, the principal causes of anemia are shown and the diagnostic approach to identify the causes are shown. The deficiency anemia varies with age, HP less than 100 milligrams, less than 4 stimulated. HP less than 110 from 1 year to 12 months of age. High inefficiency may cause high deficiency. Inadequate intake, malabsorption, blood loss. Inadequate intake is common in things because additional iron is required for the increase in the level of containing both hemoglobin children iron stores. 1 year only if it requires an intake of iron, which is about the same as an adult, meaning that only have that of an adult female. Iron may come from breast milk, low iron content, 50% iron is absorbed. Infant formula supplemented with adequate amounts of iron. Cow's milk, low iron content, poor availability, so poor source of iron. Solids do segmentate cereals are supplemented with iron, but only 1% is absorbed. Iron stores in infants are increased but delayed for clamping at birth from increasing transfusion of simple blood. Iron deficiency may develop because of a delay in the production of mixed feeding and beyond. 6 months of age in fully breastfed infants after a diet with insufficient iron food, especially if it contains a large amount of carbs. Iron absorption is increased when eaten with food rich in vitamin C, fresh fruits and vegetables, and is inhibited by vitamin D. Infants should not be fed unmodified carbs when average iron content is known bioavailability is 0. Okay, these are the causes of anemia in infants and children. Impaired red cell production, red cell aplasia. These are all causes of anemia. Okay. Red cell aplasia, virus benign infection, damage, background, anemia, congenital red cell aplasia, and this is plastic in your childhood. Varieties of Fanconi, plastic leukemia, qualitative acknowledgement process, iron, folate, vitamin, vital deficiency, chronic inflammation, juvenile, idiopathic arthritis, chronic renal failure, diabetes, myelodysplasia, and deafness. This is in three receptor structure. Red cell membrane disorders, hereditary severe red cell enzyme disorders, G6PD, hemoglobinopathy, thalassemia, sickle cell disease, immune hemolytic disease, and newborn autoimmune hemolytic anemia. Blood loss, fetal, maternal bleeding, microcephaly, chronic GI blood loss, and inherited bleeding disorders, von Willebrand disease. The clinical features, most influential and asymptomatic intercred drops below 60 to 70 grams. As the anemia worsens, children die easily in 1 feet more slowly than usual. The history should include asking about blood loss and symptoms or signs suggesting malabsorption. They may appear pale, but pallor is an unreliable sign unless confirmed by pair of the conjunctiva, tongue, or palmar creases. Some children have pica, a term which describes inappropriate eating of non-food materials, such as soil, chalk, granular foam, weapon. And this evidence around deficiency anemia may be detrimental to behavior and intellectual functions. Diagnosis includes a microcytic hypothermogeninemia with low MCV, means and volume MCH, means hemoglobin low, and affected. The other main cause of microcytic is beta thalassemia traits, usually syndrome of Asian Arab-Mediterranean origin, chronic disease due to chronic kidney disease. Children with alpha thalassemia trait, usually children of African or Far Eastern ethnicity, also have a microcytic high inflammatory blood picture, but most of these children are not anemic. Anemia reticulocyte very low, normal or high. This is differentiation of diagnostic approach. For fertility sites and low, red cell production reduced, red cell aplasia likely causes parvovirus between dino background. Useful test for the histology and movement of aspirate. And the leukocyte normal and high, either bilirubin is raised, even if bilirubin is raised, then hemolysis was normal, blood loss is qualitative, abnormal erythropoiesis. Hemolysis has HDC, sickle cell anemia, B cells, blood film, and HP. And blood loss or qualitative abnormal erythropoiesis, iron deficiency in blood films, lymphatic blood film shows spherocytes in hereditary spherocytosis, sickle cell and target cells, sickle cell disease, hypertrophic mitochondrial cells, thalassemia, and iron deficiency. HPV cells had performed liquid chromatography in some laboratories. HPV electrophoresis is used as shows. In sickle cell disease, HBS and no HBS present. Beta thalassemia, only HBS was present. Beta thalassemia trait, the mean of at least increased level of HBA to traits, and alpha trait HbA1c is normal, which is high performance secret at the level of Terminal antibody stores to 50 grams to 5% blood, 10 grams of ferritin, and osteogenic tissues. Increased by delayed quad sample. Adult iron body stores 45 grams, iron required for growth, nutrition. Iron body stores, iron intake, breast milk adequate, iron totally breastfed for 6 months, unless preterm, then mixed diet and infant formula fortified with iron. Mixed diet bioavailability 10 to 15% requirements during childhood. And dietary sources: iron, red meat, beef, lamb, liver, kidney, oily fish, bullshits and sardines, average iron, pulses, beans, and peas, fortified breakfast cereals with added vitamin C, whole meal products, dark green vegetables, broccoli, spinach, dried fruit, raisins, and sultanas, nut and seed, cashews, peanut butter, etc. Food to avoid and access into those cow's milk, tea, tender nibbles, iron uptake, high fiber food, dates, and with iron absorption. Management of emotional management involves dietary advice, recommendation, and life. The best tolerance regulation is citron, sodium ion, editate, or Netflix, polysaccharide iron complex. Unlike some other preparations, these do not stain the teeth. Iron supplementation should be continued in the HP's normal limit for a minimum of further 3 months to replenish iron stores. With good compliance, the HP will rise by about 10 grams per week. Excuse me, failing to respond to oral iron usually means the child is not getting the treatment. Investigation of other causes, particularly malabsorption, systemic disease, or chronic virology is advisable if history or examination suggests a non-dietary cause or if there is failure to respond to therapy in blind families. Blood transfusion should never be necessary for dietary iron deficiency, even children with the HP as low as 20 gram to 30 gram due to iron deficiency has arrived at this low level over a long period of time. Treatment of iron deficiency in normalization. Some people have biochemical evidence for iron deficiency lose certain but have not yet developed anemia. Whether these children should be treated with oral iron contribution in favor of treatment is the knowledge that iron is required for normal brain development, and there is evidence that iron deficiency anemia associated with behavioral intellectual impairment may be reversible with iron therapy. However, it is not yet clear whether treatment of subclinical iron deficiency confers significant benefits. Treatment also carries a risk of accidental poisoning with more iron, which is very toxic. Simple strategies to provide dietary advice to increase oral iron and soften all subchemical dietary deficiency and to offer parents option of additional treatment with oral iron treatment of iron deficiencies for dietary advice and oral iron therapy for 7 months. Red cell aplasia, the treatment causes red cell aplasia, including congenital red cell aplasia, diamond black fan, And sorry, transient nephroblastopenia of childhood coronavirus COVID-19 dysfunction causes red cell in children inherited from the illness but not in healthy children. Diagnosis for red cell and low reticular cell count despite low HB normal related with negative direct antiglobulin test. Who says that's in red cell precursors on bone marrow examination. So, uh, yeah, after this. Let's do the case history. Aisha is 2 years, was noted to with pain when she attended her general practitioner for an upper study diagnosis. Blood count showed